Misato Dilley, and I work for UNEP-IETC based in Osaka. And today I would like to talk about this waste management during the COVID-19 pandemic, from response to recovery. Before going to the topic, I just want to briefly introduce who we are. UNEP-IETC is supporting countries to implement sustainable solutions to environmental challenges with focus on holistic waste management. And IETC's main publications include Global Waste Management Outlook. The Global Waste Management Outlook 2 is coming soon, and other thematic reports and guidelines are listed here. And these are the countries that we are working with. So today's topic draws on two IETC publications. One of publication is Compendium of Technology for Treatment of Healthcare Waste, which is published in 2012. And the other one is Waste Management During the COVID-19 Pandemic, which is published recently in August. And we use healthcare waste because this is a terminology recommended by WHO, but medical waste is also more or less similar definitions. So the current pandemic of COVID-19 is intensifying its impact upon the world's population's health, healthcare system, and economy. And during this time, ensuring reliable and safe healthcare and municipal solid waste management service provision is a must for all countries to protect public health. Let's not forget the COVID-19 pandemic comes on top of an already highly precarious situation where 2 billion people worldwide lack access to waste collections and 3 billion people to controlled waste and disposal. And it is estimated that total municipal solid waste generated in the world will double to nearly 4 billion tons by 2015 compared to 2016. Uncontrolled, non-disposal or poor disposal waste has both environmental and health consequences and put extra pressure on already stretched public services. With this context, UNEP-IETC together with IGES CCET wanted to know how developing countries are dealing with these situations. We have reviewed international and national guidelines and carried out questionnaire surveys to 14 countries. These are the risks and challenges that municipal solid waste and healthcare waste are listed here. And for municipal solid waste, municipalities are faced with the challenge of rapid increase of mixed waste, which is potentially infectious, and increase of plastic waste, and discontinued provision of formal and informal services. And there is also an increased illegal dumping and suspension of recycling activities. And for similarly, healthcare waste, the rapid increase of infectious waste caused service interruptions in many countries, and they simply faced insufficient capacity for safe treatment and disposal. You can see from this graph, there is a significant increase in the healthcare waste. In Jakarta, Indonesia, for example, according to the ADV, the healthcare waste was increased from 35 tons per day before COVID-19 to 212 tons per day during the COVID-19. We also wanted to know the infectious waste generated from households, such as masks and gloves. But none of the documents or survey responses we reviewed contained quantitative information on amounts of COVID-19 waste contained in domestic or municipal solid waste. So on a positive note, awareness about potential harm from healthcare waste has now become more prominent, and not only within governments and medical practitioners, but also civil society as a whole. Most governments have started to follow existing legislation and regulation put in place by their respective countries for the management of infectious waste from hospitals and households. And in addition to the existing policies and plans, most countries we surveyed immediately issued some policies and guidance and plans to respond to the COVID-19 pandemic. International regulations and guidelines for safe healthcare waste management are available and have been widely referred to and followed by most countries. However, in many countries, the best recommended way is not always possible, especially during the pandemic and when it comes to treatment and disposal. Although most governments have made some efforts to improve the situation, findings from a questionnaire survey show that they are still inadequate to manage even the healthcare waste that is generated in the normal times. With these limited technical options and capacities, the COVID-19 pandemic and the associated increase in the volume of healthcare waste generation created additional burdens for both people and
リリーさん、すみません。ちょっと一旦ミュートになってしまいました。ちょっと戻っていただけますでしょうか。リリーさん、聞こえますか？うちの方はミュートになってない？
リリーさんがミュートになってる。聞こえますか？
大丈夫です。すみません。ちょっと戻ってください。失礼いたしました。
ここからで大丈夫。カレントプラス。
大丈夫です。はい。
はい。So, on a positive note, awareness about potential harm from healthcare waste has now become more prominent, and not only just within the governments, but medical practitioners, but also civil society as a whole. Most governments have started to follow existing legislations and regulation put in place by their countries for the management of infectious waste from hospitals and households. And in addition to the existing national policies and plans, most countries that are part of the questionnaire survey immediately issued some policies and guidance and plans to respond to the COVID-19 pandemic. And we found that international regulation and guidelines for safe healthcare waste management are available and have been widely referred to and followed by most countries. However, in many countries, the best recommended way is not always possible, especially when it comes to treatment and disposal. Although most governments have made some efforts to improve the situation, findings from a questionnaire survey show that they are still inadequate to manage even the healthcare waste that is generated in the normal times. With these limited technical options and capacities, the COVID-19 pandemic and the associated increase in volume of healthcare waste generated created additional burdens for both local and national governments. Especially, it seems evident that for treatment practice, you can see from the slide at the bottom, 14 out of 4 countries have used incineration autoclaves and specific landfill sites. But some countries even go for burning in open containers or place. And this is possibly because there is a limited availability and accessibility of treatment and disposal option for healthcare waste management in developing countries. And this caused difficulty in handling increased healthcare waste. For example, you can see from this slide, operational capacity of existing healthcare waste treatment during normal pre-COVID-19 conditions in Indonesia, including both on-site and off-site facilities, is lower than the amount of healthcare waste generated. And usually, most treatment facilities are generally located in the urban regions, while peri-urban and rural areas suffer more due to lack of treatment options. And other common issues that available treatment and disposal options are often not well designed, well built, or well managed due to lack of knowledge, capacity, and financial difficulties. In this case, interim treatment and disposal systems have to be implemented. And compromise between the environmental impact and other longer term or unintended negative health impacts will occur in order to protect immediate public health. This shows that key findings and recommendations for handling healthcare waste. I'm sorry, I know it is a lot of text, but I just wanted to highlight that there needs to be detailed considerations for each segment from separation to disposal. For example, for separation alone, it is recommended to use colored containers and proper labeling according to the waste category in each word, and separate reusable and recyclable materials, and promote use of personal protective equipment by workers in healthcare facilities, and provide training for workers in healthcare facilities. And for treatment, non-vulnerable technologies such as autoclave and incineration for treatment is recommended by many of the guidelines. So these are the 7 findings on general principles. Firstly, maintain an existing waste management system to avoid other health risks due to the service interruption of waste collection and treatment. And secondly, increase awareness on source segregation and proper storage and discharge, including double layer bag use, colored bag use, specific bag distribution, etc. And thirdly, continue the practice of material reuse and recycle as much as possible. And fourthly, examine existing treatment and disposal options for infectious waste management and promote the best available option to mitigate transmission risk. The appropriate selection of treatment options need to consider many aspects such as national and international regulations, environmental and occupational health safety, waste profile, technology capability and requirements, cost and operations, and so on. Fifthly, permit temporary licensing, long-term storage, inter-municipality collaborations, and transboundary arrangement for proper waste management in a timely manner. And also protect lives and livelihood both of formal and informal sector workers who are involved in waste management system. And lastly, but not least, ensure gender equality is taken into account using gender disaggregated data, women's participation in decision making, and introducing health and safety measures. As we all know that this pandemic will come in the future, and we don't know this current pandemic will last, how long this pandemic will last. Therefore, key priority area that government should focus on is to improve healthcare waste management to prevent the spread of COVID-19 and to develop resilience and preparedness for similar events in the future. It is important to encourage evidence-based and informed decision-making for not only recovery, but also building back better. This illustration shows that the steps from emergency to recovery phases. Step 1, carry a quick survey and map source of waste generations to develop the contingency plan, then adjust the waste management service. Again, review the existing waste management service to develop preparedness plan in the future. On top of improving and investing on waste management practice, we also need to start working on the establishment of national policy and the legal framework if not already available, and ensure enforcement of these policies. We think that additional regulations on guidelines for healthcare waste generated from non-healthcare facilities such as household and public places, especially due to increasing generation of potentially contaminated waste, waste are needed. And secondly, raising public awareness and capacity development are essential elements of successful healthcare waste management. We think additional capacity building and awareness raising is urgently needed for households, informal sectors, including waste pickers, emergency healthcare facilities which employ volunteers and temporary workers, and mostly many of them are women as well. And thirdly, data management. We need to ensure that good and valid data is obtained related to waste management and COVID-19 so that can inform better policy planning in the future. I would also like to highlight the collection of gender disaggregated data, this time on waste, is also important for sustainable waste management. It is easier to say than do, but we also witnessed a new challenge. The COVID-19 crisis has led to a rapid expansion in the production of plastic products. In response to high PPE demand among the general public, healthcare workers and service workers, single-use face mask productions in China, for example, rose to 116 million per day in February, about 12 times the usual quantity. According to a report published by IETC, the primary component of institutional healthcare waste is plastics. So on this slide, sorry, the resolution is not very good, but the red in pie chart are plastic. And indeed, hospitals in Wuhan, the center of the COVID-19 outbreak, produced more than 240 tons of single-use plastic-based healthcare waste per day at the peak of the pandemic. So this is about 6 times more than the daily average before the pandemic occurred. And if the increase is observed in Wuhan hold true everywhere, apparently it seems that the US could generate an entire year's worth of medical waste in 2 months. Also, due to the changes in our lifestyle, we use more delivery, which led to an increase of packaging waste. Some countries have temporarily lifted plastic bag bans, and some major companies like Starbucks, for example, have suspended reusable cups as precautionary measures against the spread of coronavirus. And these trends poses serious challenges to global efforts to reduce plastic pollution. COVID-19 related plastic has been already observed on beaches and in water, potentially aggravating the challenge of reducing microplastics. So how do we achieve waste minimization and recycling and transition towards sustainable lifestyle and a more circular economy in the COVID-19 era? Unfortunately, we don't have answers yet, and we are still finding out about best practices of managing plastic waste during the COVID-19. And I would love to hear if you have any best practices, if you have. But one thing for sure, that we all need to commit to reduce single-use plastic. And healthcare waste management should aim to avoid or recover as much of the waste as possible, rather than disposing of it or by burning. But we should all carefully pay attention to scientific insights, such as the viability of the virus on different materials, in order to adjust of our existing waste management and recycling as well. I just want to highlight this because without a combined effort to protect the environment during and after the pandemic, we are unlikely to meet the Sustainable Development Goals. Thank you for listening. That's it from me. If you have any questions, I'm happy to answer. Thank you very much.
Thank you very much. Thank you very much, Ms. Dilley. we have few minutes for questions and answers. If you have any questions, participants, if you have any questions, please turn on your camera and unmute your microphone. Okay, let me ask one question, Ms. Dilley. Does UNEP-IETC have any new program to support municipal waste management under COVID-19, especially in developing countries? Do you have some new next program?
Thank you very much, Mr. Furusawa. We are proposing some projects related to municipal solid waste related to COVID-19, including plastic waste. So we will keep you updated on the proposals that we submitted to a couple of donors. So we are definitely planning, and that's one of our priorities to work on. Thank you very much.
Thank you very much. Any participant can ask a question to Ms. Dilley. Okay.
Okay. Good afternoon from Bangkok. And how can I share? I'm Suchada Bosap, Sanitation Technical Officer from Department of Environment, Bangkok Metropolitan Administration. And today we will talk about the infectious waste management in Bangkok. And I will talk about in the normal situation of the solid waste management in Bangkok, and also during the COVID-19 pandemic. Let me explain about the definition of the infectious waste in Bangkok. About the definition of the infectious waste, it means waste contain the pathogen. We follow the Public Health Ministerial Regulation on the Disposal of Infectious Waste 2002. So it also means waste from the process of the medical and also from human or animal process in the hospital or in the medical process. And according to the ministerial regulation, infectious waste has divided into 4 groups. Like the first one is like the body part of the human and animal. And also for the second one is like a contaminated material from blood or body fluid. And also for the equipment from the hospital, we also define as an infectious waste. And the last one is like all waste from serious infection carry ward. And let me show you about how we manage the infectious waste in Bangkok. We are Bangkok Metropolitan Administration, or BMA. We are like a local government, and also on behalf of Department of Environment, we have like a private company, like they have a license for infectious waste permission for collection and disposal. So after they collect and transfer to the incineration plant, they will report the amount of the infectious waste to Department of Environment, and then we collect the collection fee from hospital or healthcare facilities. This is how we collect the solid infectious waste from healthcare facilities. This is the storage from hospital or healthcare facility. After that, the private company, the name Krungthep Thanakom, we have only one company to manage the infectious waste in Bangkok. Also, they weigh the amount of waste before. After that, they transfer with the specific truck with the temperature controlling and transport to incineration plant by the special truck. This is the way from hospital, and then they transfer to infectious incinerator. We have 2 infectious incinerator in Bangkok, and then go to scale landfill for the ash. About the number of healthcare facilities, most of them are clinic. It's about 80%. And some of them is the BMA hospital, BMA like a government and private hospital. And another one is like a veterinary hospital from animal. Let me show you the amount of the solid waste and the number of healthcare facilities. From 2008 to 2019, the amount of the solid waste is continuously increasing from 7,000 tons in 2008 to 15,000 tons. And also for in 2019, the infectious waste amount is about 42 tons per day. It's increasing every year. Under the COVID-19 situation, so people wear a lot of face masks in Bangkok, and also we have to have a plan to control and manage the infectious waste that have a lot of use face mask management, and also infectious waste during the COVID-19 before hospitalization, and infectious waste from quarantine, like state quarantine or alternative state quarantine. And let me show you about the use face mask. If you come to Bangkok, you will see a lot of people wear a face mask and then they throw away. And we have to have a plan to control the face mask that may be contaminated with COVID-19 disease. So we promote people to separate before the district office come to collect, and then the district office will collect and send to the incineration plant. And also we have a drop-off at the district office and BMA Healthcare Center. Also BMA has hospital. And about the COVID-19 situation, we have to separate the general waste and infectious waste. For the infectious waste, we also have like a private company to collect like a specific truck to collect the infectious waste and then send to the incineration plant. This is the amount of the collected infectious waste in Bangkok. You can see from 2019 on the left-hand side, it's the amount of the infectious waste is about 42 tons per day. But from January 2020 to August 2020, during the COVID-19 pandemic, you will see the yellow colors is like the amount of the COVID-19 infectious waste. In August, it's about 5 tons per day, as you can see in this graph. Not only infectious waste management, we also take care our staff with preparing the equipment, like personal protective equipment for our waste collectors, like full-length gown, or we prepare boots for our staff to protect the transmitter of the pathogen of the COVID-19 as well. This is the picture that show you how it's look like the gown and the clothes of our staff. And this is the information of the infectious waste during the COVID-19 in Bangkok. And thank you very much for your attention. And if you have any question, please feel free.
Thank you very much. I'm sorry, but we have enough time to for questions and answers now. So if you have any questions to Bangkok City, please write it down in the chat box, please. So thank you very much, Bangkok. Thank you for sharing your experience. And we got next city. Dubai. Oh, okay.
Sorry. So, hi from Melbourne. We have, sorry. Could you go to slide 2, please?
Okay. This slide is from our side.
That's okay. I do have mine here. If you stop yours, then I can start mine.
I'm sorry, Ms. Clark.
That's okay. Here we go. Hi from Melbourne. So I'm Victoria from the city of Melbourne. So before I start, I'll just say that Australia is broken down into 3 levels of government. So we have federal, state and local, getting smaller. And City of Melbourne is just a local council within Melbourne. So Melbourne has 4.9 million people, and the City of Melbourne is just the central business district. So just downtown Melbourne. So it's very small. It's got about 180,000 people in about 90,000 dwellings. And those numbers have gone down since COVID started because we had such a high population of short-term residents, including international students who have left Melbourne because of the pandemic. So we collect about 40,000 tonnes of landfill and 100,000 tonnes of recycling each year. So most of it goes to landfill, not all of it gets to recycling. And we only collect from houses. We don't collect any waste from hospitals, doctors, dentists, clinics, anything medical. So we don't deal with the infectious waste coming out of hospitals. We only deal with the waste from residents. So we pick up landfill recycling, large waste items and some garden waste. And we do a small number of businesses as well. Melbourne is in Australia's 2nd wave of COVID right now, and we have the highest number of infections in Australia. So a lot of the businesses are closed right now. We have contractors who collect the waste from our houses, and they have COVID safe plans. So there's a contractor to pick up the waste with the trucks, and then they take it to a transfer station where it will go to landfill or to the recycling centres. So each of those contracts are different businesses and they all have their own COVID safe plans. So that includes things like daily checks to go through all of the health and safety requirements. There's a lot of signage at work sites about sanitising hands and wearing a face mask, which is now mandatory in Melbourne. Not many visitors to work sites. They've got a lot of detailed processes if someone is feeling unwell. And they've also reduced team sizes so that not as many people are coming into contact with each other. And you can only work on one site, so you can't move between work sites in a day. You stay at the same place for the whole day. Mandatory face masks and temperature testing when people start working. And all the vehicles, offices, processing equipment is sanitised every day. And people need to practice the physical distancing, staying 1.5 metres away from each other. So a lot of that is consistent with how all businesses are being required to operate in the COVID era. We've had a decrease in the amount of waste that we collect because the population has been decreasing, because people are leaving the city of Melbourne and have returned overseas or are moving out into the country. So there's actually less waste to process, and we're still recycling where we can. If we know that a household is infected with COVID-19, the only difference is that all of their recycling material goes to landfill, because what normally happens is that you can see the picture here. There are people on a conveyor belt picking out different things from recycling. So because we have the manual handling of recycling, we won't let infectious recycling go through the processing plant because we don't want to expose those workers to the virus through contaminated items. So that's the main change from us. And that's the main gist of my presentation. I'm so sorry it took a little bit of time to get going, but I'll finish there. Thank you.
Thank you very much. Thank you for sharing your experience. Thank you very much. And next up, we have just Manila City have just joined us. Manila City, can you hear us? Can you hear me?
Hello, hello.
Hello.
Yes, I can hear you.
Yes, it's very clear. Very well. Do you have something to share with the participants?
Yes, I do have something to share. If you can allow me to share my screen. Here.
Please do it.
So,
In 7 minutes, please.
thank you. So, hello everyone. I am James Christian Rebesa. I'm a technical staff from the Department of Public Services of the City Government of Manila. So basically, we are the primarily involved in the waste management and collection in the City of Manila. So anyway, here is my presentation, the COVID-19 healthcare waste management of the City of Manila. So, all in all, we have an accredited transporter for our healthcare waste. They are the one who collects the healthcare and other kinds of waste with our quarantine facilities, hospital, health centers that located in the city. So sadly, we do not have the capability yet to collect and separate the healthcare waste in our household level. However, we already released a memorandum to our 896 barangays for the protocol on the guidelines on the management of COVID-19 healthcare waste, specifically to the segregation of the biodegradable, non-biodegradable, hazardous, and the healthcare waste. And we advise them to disinfect all of the waste so that whoever collects the said waste will not be infected if ever. So we also released our IEC campaigns on the proper handling of the hazardous waste. So this is what I was mentioning earlier, that um, we instructed our constituent to separate all of their household healthcare waste in a separate yellow bag, which is with a label that either household waste or household healthcare waste, or use face mask or face shield, because we are also so far collecting them. So before collecting the garbage, we are also disinfecting them with bleach and alcohol before disposal to our before collecting by our accredited hauler. Here is one picture of the disinfection of our waste. We are also disinfecting our garbage trucks so that after every operation we are disinfecting them, so there will be lesser trace of the bacteria virus in our trucks. Also, we are specifically instructing all of our staffs and our collectors to the proper wearing of other personal protective equipment right here. There. So also we are doing our misting and disinfecting operations all throughout the city of Manila. So far that is all the efforts done by our city. We are that's all. Thank you.
Thank you very much. Thank you for your thank you for sharing.
Thank you.
Okay, I can see your presentation. Please go on. Please go ahead.
Okay. So I will be presenting the waste management and cleaning services Milan during the COVID-19 pandemic in March-May 2020. Italy, and especially the region of Lombardy, was one of the first countries to be hit really hard by the COVID-19 virus. So the spreading and the very strict lockdown greatly impacted the waste management and cleaning services in the city, especially due to the personnel availability for diseases increased beyond the standard right at the beginning, March, and we had a few cases of COVID-19 among operators. We had initial supply shortages of masks and other protection equipment, but quickly solved. And the other was the result, the reduction of waste production and movement of people around the city. So to address these issues, a rationalization plan adopted in early March to secure the continuity of essential services, such as door-to-door waste collection, illegal dumping removal, and the cleanliness of the city in order to help limiting the spreading of the virus. About waste data, in relation to the very strict lockdown, the municipal solid waste decreased by 27.5% on average. But we still managed to get recycling rate up to 1% from last year in the same period. So you can see that all of the waste decreases, including street bins. In Milan, AMSA, which is the waste collection company, manages household waste and commercial and businesses waste, but not healthcare waste, like in the city of Melbourne, said before. The plan, the main goals of the plan was to guarantee the continuity of essential services, such as waste collection, have no impact on the global level of cleanliness of the city, and the services were calibrated to the new conditions of reduced production of waste and reduced attendance of people. We wanted to create personnel, reserve of personnel to be called back in case of increase of absences. Of course, to keep the health of personnel as much as possible. And new special street sanitation services was put in place in public spaces, and of course continue to commit the human resources available for street sanitation activities. Here you can see the reduction of the waste. We had a 100% reduction of total mechanical sweeping, and manual sweeping also reduced 100% according to the new plan. About door-to-door waste collection, we kept the services regular and carried out at usual times and days, as well the reservation of a collection of bulky waste. We kept 2 recycling centers out of 5 open, but access was restricted to a number of people. Non-essential services like the mobile eco center, all the other services were suspended. Here are the indications that were put in place for how to do the households or separate collection according to the Italian National Health Institute. So these are also in place today. Citizens who are not positive should follow the usual methods of separate collection. And disposal handkerchief, masks, gloves, all should be thrown in the residual waste, using 2 or 3 bags to be more safe. And all this, the residual waste is sent to incineration for maximum protection, safety. Citizens who are positive should not carry out separate collections. So all their waste should be put in the residual waste using the transparent bag, and use also 2 or 3 bags. And this also goes to, and all this waste goes to incineration at the end. Now, a brief focus on streets and sanitation. This was a special activity carried out in public streets and in public spaces. We had dedicated vehicles use a sanitizer, sodium hypochlorite in aqueous solution at the lower percentage, according to the technical requirements of our agency, to reduce environmental impacts, and the special attention was dedicated to the safety of citizens, our personnel. We conducted 2 sanitation campaigns from March 12 to April 3rd, and April 14 to May 2nd.
Sorry to interrupt you, but we don't have enough time. I'm very sorry. Could you summarize the rest of your discussion?
Yes, I'm just going to
in a couple of minutes.
Yes. Yes. Now, okay. Now the current situation. Now all services are regular according to our usual schedule. Canteens for employers are still suspended. We have continuous distribution of masks and PPE, mini kits for individual sanitation. We have a distribution of gel in all operating offices, and we continue with smart working for staff members and reduced presence for the elderly workers. So that is all, and thank you for the attention.
Thank you very much. Milan's experience is very valuable and helpful for us. Thank you for sharing your experience. Thank you very much. And next city is Mexico City. I apologize for the delay. Thank you for waiting.
Thank you.
Elsie, could you stop your sharing slide? Thank you. From Mexico City, Ms. Andrade, could you start your presentation?
Sure, I'm ready. Can you hear me?
Yes.
Perfect. Well, I'm going to tell you some information about Mexico City's work on this pandemic. First of all, I'm going to tell you some of the important data of Mexico City. And the most important is that we have 9 million inhabitants in the city, and the metropolitan area, we are 22 million of inhabitants. We produce 13,000 tons of waste per day, and our per capita waste generation is around 1.5 kilograms. We now have 4 categories for disposing household waste. We work in biodegradable waste, recyclable waste, non-recyclable waste, and bulky waste. This is the COVID pandemic in Mexico City. The first case detected in Mexico was on February the 27th, and the lockdown started in April the 21st. We have identified some waste management challenges amid the COVID-19 pandemic, which are to improve waste management of personal protective equipment due to the sudden increase of its use, to avoid mixtures of household sanitary waste with recyclable waste, due to the population's fear to contagious risk, to reduce the risk of virus transmission from the surface of the materials, specifically of the waste, to reinforce the single-use plastic ban that started this year in Mexico City with the plastic ban of some materials. Well, we identified some of the persons at risk during the solid waste management, such as the scavengers, the municipality workers while transporting the waste to the transfer station, the waste workers management facility, such as the sorting plants, transfer station, and composting plant, and obviously the communities that are exposed to the improper disposal sites. Here are the steps of the solid waste management in Mexico City. We start with the household waste generation. We collect and transport in charge of, and that is in charge of the municipalities. At the transfer stations, we collect and send them to the treatment facilities and then to the landfills. We identified that we have 4 actors, such as individuals, who need to proper sort and disposal of sanitary waste, the municipalities that collection service, manual and mechanical road sweeping, the Ministry of Public Works and Services works at the management, coordinate and operate of 3 treatment sites, 12 transfer stations, and delivered to 5 landfills out of Mexico City. And with the Ministry of Environment, share information or provide information regarding the COVID-19 and the solid waste generation and responsible consumption. We have identified that must work on the labeling. We identified bags with household sanitary waste are delivered to transfer stations. We have special containers in every transfer station to segregate the household COVID-19 waste. Transfer stations are sanitized daily, and in household COVID waste is sent to an incineration plant. We, as Melbourne, does not work on the hospital waste that is managed by a private. Here are some of our. We have some actions and recommendations for the collective services, such as correct label, manage those bags separately from the rest of the waste, household waste. These are some examples. The local government has released different materials, such as guidelines for different activities in public transport, shopping location, domestic workers, and more. And some recommendations to avoid single-use plastics and to reinforce that hygienic is the way to stop COVID-19. And that's all. I think I did it rapidly, so.
Thank you very much. Thank you very much, Mexico City. Thank you, Ms. Andrade. Next city is Paris. Thank you for joining us. Paris, could you start your presentation?
Yes.
Do you hear me?
Hello. Yep. Okay.
Okay.
Yes.
Could you start?
So I'm very. Yes. Okay. So hello everyone. I'm very pleased to participate in this webinar. My name is Quentin Chabernaud and I work for the City of Paris. I am cleanliness manager in the waste management and water department in Paris. There are almost 7,000 agents responsible for street cleansing and waste collection. There are 14 local divisions for this. As has been pointing out by other cities, the tonnage of waste collected fell sharply during containment. They have fallen by the order of a third. Door-to-door collection continued and did the cleanliness of the streets. I will hand the floor over to Emilien Chérancé, Health and Safety Officer, who will talk to you about biological risk and our prevention strategy. Thank you.
Thank you, Quentin. Hello, my name is Emilien Chérancé. Do you hear me?
Yes.
Yeah.
So I'm in charge of prevention of occupational risk at the City of Paris, and I'm going to present you the approach we've used to deal with the COVID-19 in the recent months to protect our staff and the population. The last few years, we already faced different types of biological risk. For example, we've got migraine cramps. Then Parisians ask us to remove mattresses infested by bed bugs. For our different cleanliness activities, we were already used to adapt the level of protection and our organization facing different levels of biological risk. Since March 2020, we have to deal with the COVID-19. For that, we already had a basis of preparation because since H1N1, it's mandatory for us to prepare a continuity plan upstream each type of crisis. For this sanitary crisis, we had a stock of PPE and a special organization to focus on essential tasks without using as many staff as usual. This continuity plan has been adapted to the specific condition of COVID-19 using a standard method for the prevention of occupational risk. We first updated our risk assessment taking into account the instruction for the French health authorities. This had led us to modify some of our operating methods. For example, we stopped using leaf blowers to avoid clouds of particles. Then we asked to limit contact with the weights by handling them with tools. And we also paid a particular attention to the premises where our staff changes and eats. We have developed reinforced protocol for cleaning and disinfecting contact points. We have placed stickers to remind of a number of rules regarding social distancing inside our buildings. Moreover, we have stepped up the cleaning and disinfection of vehicles, as you can see. And depending on the operation and the risk assessed, we have adapted the PPE. At the minimum, each garbage collector uses gloves adapted to the biological risks and a mask, since it is now compulsory in the streets of Paris. And for the cleaning activities that generate water mist, as you can see on the picture, such as washing trucks, staff is protected from head to toes with a ventilator and use ventilator mask. To inform the staff, we have prepared short documents with icons and diagrams. They were presented during daily briefings of 5 to 15 minutes. These same instructions have been also sent to our subcontractors. And all our efforts were supplemented by the help of the Parisians themselves. They have been asked to have a particular attention for potentially infected wastes like masks or gloves. And finally, my team carried out audits in the workshops in order to share the best practices and report the difficulties encountered. From this experience, we retain 3 points. First, keep updated a continuity plan in the event of a health crisis with a stock of PPE and the identification of priority activities. Then develop the agility of foremen so that they can adapt the activity from day to day according to health constraints. And finally, gain continuous feedback from the ground to adapt the protection measure. Thank you for your attention.
Thank you very much. Thank you, Taris. Thank you for sharing your very helpful information. Very helpful for us all. Okay. Next city is Quezon, Philippines. Are you ready?
Yes. Can you hear me?
Okay. Please start your presentation.
Okay, can I start now? So first, on behalf of our Mayor Josefina Belmonte, we would like to thank the Tokyo Metropolitan Government of Japan and other organizers for inviting Quezon City government to present our waste management programs in the time of the COVID-19 crisis. As background, the Task Force on Solid Waste Management was created by Mayor Belmonte through Executive Order Number 3 to supervise the city's waste management programs and compliance monitoring. This is chaired by our Secretary Ricardo Belmonte Jr. and Mr. Richard Santuili as our Action Officer. This is a precursor unit for a proposed department that shall deliver sanitation excellence for Quezon City. For brevity, our action team is named as Task Force on Solid Waste Management. So since in the implementation, since the effects of the COVID-19, our task force is implementing various projects for anti-COVID-19 response activities. First is the sanitation project, sanitation and disinfection project, which was implemented in since May 2020. So this project is implemented at city-identified COVID-19 support facilities and facilities, including the perimeter area. So this includes our COVID-19 facilities, such as quarantine facilities. We have HOPE facilities that cater for positive patients. And then we have community-based testing centers or swabbing stations. And then we also sanitize the Quezon City Hall complex and offices, and other vital government facilities, including the Baysa Crematorium, special concern areas or barangays in our city, and including the waste generated from these locations. To ensure the safety of our workers, our personnel are equipped with personal protective equipment. And for our cleaning, wipe down, mopping, and misting are methods used during the operations. Next on our activities is the special waste collection. This project is implemented by the task force since June 2020 at the same facilities, the city-identified COVID-19 support facilities, such as the HOPE facilities, the hospitals, the quarantine facilities, and also the community-based testing centers, areas under special concern lockdown, and other interim locations. This project is implemented to minimize the transmission of COVID-19 through waste disposal, especially from the said areas. So similar to the other project, our personnel are equipped with PPEs to minimize the transmission of the virus. So the city has engaged the services of a service provider who handles the proper collection, treatment, and disposal of special waste, including the used PPEs from the city government identified facilities. The task force is also part of the city's Ease of Doing Business initiative, or the Business One-Stop Shop, as an anti-COVID-19 measure. As a development in the second quarter of 2020, the task force implemented online environmental clearance application as part of the ancillary requirements for a local business permit. Applications are now done online for secure and real-time monitoring of submitted documents, which can be done at the safety of their homes. For safety concerns, Task Force also offers free easy delivery to the establishments. And during the delivery, the on-site visits also serve as initial visual inspection of these businesses by our compliance officers. Now for the other areas which do not have positive cases, we still implement continuous solid waste management services. So part of this is that pursuant to recent local ordinances on the wearing of the PPEs, the city government issued a memorandum to our service providers to ensure that the PPEs are distributed to their waste management personnel, including the drivers and the dump truck drivers and the garbage collectors. So these are some of the photos taken during the activities. We have regular waste collection, special operations, special cleaning operations at dumping-prone areas. We also have river waste cleaning operations group and our street sweepers. We also implemented our online referral system. As the city adapts to the new normal, the Task Force on Solid Waste Management Facebook page was established on May 2020 as an online referral system to receive online complaints, feedbacks, comments, and suggestions. Identified personnel are monitoring this page and our official email address to handle the queries and quickly relay these to the concerned units for appropriate action. A tracking system is implemented to monitor the status of each online communication received and remind the concerned units on pending cases. For transparency and public engagement, daily social media contents are published containing relevant announcements and accomplishments of the Task Force on Sanitary Services.
Sorry for interrupting. Could you summarize the rest of your discussion?
Okay. So with the COVID-19 current challenges on implementing 3Rs on waste management, our main concern is the high volume of household waste and non-reusable items, such as the mask, gloves, face shields, and other PPEs. Another concern is that waste segregation in COVID-19 facilities, especially the special concern barangays, during lockdown. Because during the onset of the community quarantine in Metro Manila, the task force issued a memorandum to all punong barangays or the community leaders, enjoining them to inform residents to segregate, separate, and sanitize their waste. However, sanitation concerns are being raised on the handling of recyclables, which may unwittingly contain the virus and further contaminate other communities. So that's our presentation. Again, thank you very much.
Thank you very much. Thank you very much. Thank you for your very helpful information. Next city is Seoul. Ms. Hye-jun Yeo, please start. Could you start your presentation?
Yes, can you hear me?
Yes.
And that's good. Let me get the full screen. Okay, thank you. Hi everybody, I'm Hye-jung and I'm working for the Seoul City government. And I'm very happy to have this opportunity to share with you how in Seoul we are managing COVID-19 healthcare waste. Okay, so This slide shows how healthcare waste is classified and managed in South Korea. Healthcare waste is classified into 8 different types, and waste generated by people test positive for COVID-19 is treated as what we call separated healthcare waste. Since 2008, South Korea has been using RFID systems to monitor and manage the entire process of medical waste discharge, collection, and treatment in real time. All the healthcare waste workers in South Korea are required to use these systems. RFID readers that we use scan the text on the dedicated medical waste bins, enabling us to monitor information on how waste is generated, collected, and treated in real time. The information from the RFID readers are accessed by the Ministry of Environment and local governments in the country. This slide shows how South Korea's response has kept scale up as we have a growing number of confirmed cases. The Ministry of Environment developed and enforced special measures for safe management of COVID-19 waste on January 30th. These enhanced measures focus on preventing second infection from waste discharge, collection, and treatment by putting forward guidelines for each type of COVID-19 treatment centers. According to the enhanced measures, waste from people infected with the virus is considered separated medical waste, and such waste is now collected and treated on the same day as it is discharged. Waste generated by patients with mild symptoms staying in what we call community treatment centers is also treated as separated medical waste, while municipal waste generated from the operation of the centers are treated as general medical waste. Those in self-quarantine awaiting for test results are not allowed to discharge waste outside of their homes until they prove negative. Waste generated from houses or other places visited by people who turn out to be infected with the virus is sent to healthcare facilities following disinfection of the premises for treatment later on. We disinfected places visited by the confirmed patients and safely dispose of waste generated from the places. We also ensure that we protect the safety and health of people working in the waste sector. Now let me share with you how we at the city level is working on COVID-19 waste management. Seoul had a total of 5,923 confirmed cases between January and September. We have so far incinerated a total of 745 tons of healthcare waste generated from 252 medical facilities, including national hospitals, screening centers, and community treatment centers. Also, we have safely incinerated a total of about 360 tons of municipal waste produced from houses following release from home quarantine. Let me now briefly share with you some of the COVID-19 facilities that South Korea proudly adopted for the first time in the world. Many of you may have known about this by now. Drive-through and walk-through screening stations were adopted for swift and extensive screening. We have secured some hospitals that could be accessed safely by those with underlying diseases without worrying about potential infection. Such hospitals are operated in separation from COVID-19 hospitals. We designated community treatment centers in order to isolate and treat patients with mild symptoms and suspected patients. There are 7 such centers in Seoul at the moment. We also designated temporary living facilities to provide places for self-quarantine to inbound travelers. Currently, 4 such facilities are in operation. We disinfect these facilities before and after people come and leave and provide self-quarantine kits that include a medical waste bag inmates should use when they discharge their waste. People under self-quarantine in these facilities discharge their waste, put into the provided bags and bins outside their rooms. The waste is collected and transported for incineration on the same day. Yeah, I think this is it. Thank you.
Thank you very much. Yeah, thank you for your very helpful information. Thank you. Thank you, Phil. The next city is Singapore. Singapore, are you ready?
Yes. Hi, everyone. Hi.
Okay. You start your presentation?
Yes. Can you see my screen?
Yeah.
Okay. Thank you, all of you, for inviting me and Singapore and my colleagues to this workshop. We're very pleased to have the chance to interact and exchange ideas with all of you. Just hang on a second. The presentation I'm making today is slightly different from some of the content that the other participants have covered. We are talking today about solid general waste management in the time of COVID. For healthcare waste, we do have another regime to take care of healthcare waste to the most stringent requirements according to guidelines. But today we are going to talk about what we do, the precautions that we take for general waste. So as we understand, there's also risk of COVID transmission for just general waste treatment and disposal as well. So what we do in Singapore is to provide reminders to waste generators to ensure that all waste is properly bagged and deposited within the refuse bins, that they're not overly filled, that they're properly covered with lids when stored, and the refuse generated is cleared daily, and they're kept clean and without spillages. This is to ensure that even general waste is there's no risk of transmission of the virus. So for waste collectors, we have what we are worried about in Singapore is that waste collectors and waste disposal facilities are considered essential services in Singapore. And so if there is an outbreak, we do not want that to affect such essential services. So we also have requirements to ensure that these essential services are not disrupted. So what we have in Singapore is that we require all drivers and crew working on the grounds to wear PPE and masks during collections, and also have access to hand sanitizers. And we also have workplace safe distancing measures to be complied with. We also require waste collectors to have business continuity plans in place. So what are business continuity plans? Basically to split their workers into teams, separate teams, and make sure that these teams do not interact with each other, with one another, so that if one team experiences an outbreak, they do not affect the other teams that are working as well. At our waste disposal facilities, we also have split team arrangements for our staff and contractors, and staggered rest hours, video conferencing as much as possible, restricting access to the central control room, communication via walkie-talkie. So all this is to just minimize the physical contact between people. Separate transport for operations shift groups, frequent disinfection of workplaces, donning of PPE, safe distancing, and also we have we have temperature taking twice daily. And then the last of all, what we call safe entry in Singapore, which is an electronic system via mobile phones to register entry and exit from premises that can be tracked centrally to see that, to monitor the people who enter and leave a premises. So this is for contact tracing purposes in Singapore. So these are the measures that we have put in place for general waste, the waste generators, the waste collectors, as well as the waste disposal facilities to minimize the risk of COVID transmission. So that is the end of my presentation. Thank you very much.
Thank you very much. Thank you for your for sharing your great experience. Next city is Tokyo. From Tokyo, Ms. Marino Utsuji will present. Okay. Okay. You start.
Okay.
Go ahead.
Hello everyone. My name is Marino from Tokyo Metropolitan Government. Today I'd like to talk about infection prevention measures in Tokyo. First, I'd like to describe the update on COVID-19 in Tokyo. This chart shows the daily number of people tested positive and percentage of positive in Tokyo. We were not sure where the infection occurs, and the number of infected people rose rapidly from late March. And from April 11, Governor of Tokyo asked businesses to suspend, so the restaurants, facilities, and offices are closed and people stayed home. As you can see, daily number of tested positive moves at a high level, so the expert says we need to be cautious about the trend since it might increase anytime. And even though the positive percentage is gently decreasing, they say we need to be careful with the future trend. This chart shows year-on-year rate of the volume of waste in 23 city areas. This area is center of Tokyo and the population is about 9.5 million. Here, the amount of household waste increased by 10% compared to the previous year due to people stay home. At the same time, the amount of waste from office buildings significantly dropped by 40%. As a whole, total volume of waste has declined about 9% in April and May because the number of commuters from surrounding area has fallen. In Tokyo, patients who demonstrate mild or no symptoms stay at home or temporary lodging facilities, business hotels. Since each city is responsible for treating the household waste, waste from people in self-isolation was handled by municipalities. We have enough incinerators in Tokyo, so it is conducted with the normal waste collection. But the difference is they ask patients to securely tie the garbage bag and keep the recyclable waste for 1 week before taking them out. Waste from hotels, waste from temporary lodging facility, is treated as municipal waste or industrial waste. Since TMG runs the operation of the hotels, we take care of the waste in cooperation with municipalities and private sectors. And lastly, the waste from hospitals and clinics is processed as infectious or non-infectious waste. It is same as the usual operation. In Tokyo, there are enough facilities to treat the infectious waste, but if there is an explosive rise in coronavirus cases, there was a possibility the amount of waste exceeds their capacity. In conclusion, it has been crucial for Tokyo to fully utilize the existing infrastructure, including municipal solid waste incinerators. because the total capacity of medical waste incinerator is limited. What is important on safety management is to pay close attention when people handle the waste. So Ministry of the Environment published several kinds of leaflets for different targets. National government, prefectures like TMG, and municipalities together communicate with citizens using these leaflets. And this slide shows the leaflets for temporary lodging facilities and medical institute and staff. Workers engaged in waste collection feel the risk of infection every day during the work. So Ministry of the Environment also published a leaflet for sanitation workers, which explains the things to do before work, during work, and after work. Every sanitation worker should take care of his or her health care, for example, avoiding the 3 C's. For your information, please refer to the website of Ministry of the Environment. You can see Q&A there. Owing to these efforts, waste-to-person infection has not been confirmed yet in Japan, but we have several cases of person-to-person infection at waste collection offices, where many sanitation workers gather in limited place, stand close with each other before and after the job. So we have to pay careful attention to the infection prevention measures in those offices. During the pandemic, public attention for the essential worker increased. Many more people got to have the interest for waste, and there are many letters of gratitude sent to the sanitation workers from citizens, and it was widely reported through the media as well. Now this brings me to the end of my presentation. Thank you very much for your attention.
Thank you, Marino. Next city is Tomsk, Russia. Are you okay? Could you start the presentation? Okay, could you start?
Yeah. As of the 22nd of September 2020, 6,800 COVID-19 cases were recorded in the Tomsk region. The total population of the region is 1,079,000 people. Thus, coronavirus cases were diagnosed in less than 1% of the residents. Most of the infected were revealed in the regional center. According to the decree of Tomsk administration, some particular restrictions of citizens' free movement were introduced from the 31st of March 2020. The most important ones are associated with the mandatory use of personal protective equipment, such as single-use or reusable masks, respirators, protective gloves, or antiseptic hand sanitizers in closed crowded places and public transport. Due to the current epidemiological situation in 2020, an increased amount of single-use masks and protective gloves for waste has been generated both in health facilities and as a part of municipal solid waste. The Ministry of Health of Russian Federation provided clarifications on the management of waste generated during the implementation of measures for the COVID-19 spread prevention. In accordance with these clarifications, waste management must be carried out in compliance with the sanitary and epidemiological requirements for the extremely epidemiological hazardous waste management. This kind of waste should be disinfected only in a decentralized way, using physical methods such as saturated steam under excessive pressure exposure, temperature, radiation, or electrification, or chemical methods such as disinfectants. Thermal destruction in waste incineration or other thermal treatment plants is also allowed. Storage and transportation of non-disinfected, extremely epidemiological hazardous waste are not permitted. The Federal Sanitary Service of the Russian Federation recommended to place personal protective equipment used in daily life in a separate plastic bag and to dispose it with municipal solid waste. 42.2 million rubles from the federal budget and 15.5 million rubles from the regional budget were allocated to support regional apparatus for municipal solid waste management. This is due to the redistribution of waste generation. The amount of waste from the population has increased. However, that from the enterprises has decreased due to their closing. But the total amount of waste because of the COVID-19 spread has not changed in the Tomsk region. Actually, that's all. Thank you for your attention.
Thank you very much. Thank you for sharing your experience. Next city is Yangon. Yangon, can you hear me? Are you ready for the presentation?
Yes. Good afternoon, everybody. Can you hear me?
Yes.
Okay. Okay, good afternoon, everybody. My name is Dr. Aumimo, Director of Urban Environmental Conservation and Cleansing Environment Management Authority, Yangon City Development Committee, behalf of Myanmar, Yangon City. I would like to present the solid waste management in Yangon City during COVID-19 pandemic. Please, next.
Mimo, could you share your slide? And please turn on your camera, please.
Can you hear me?
Yes, and I can see your presentation.
Yes, please wait.
Could you please turn on your camera?
Camera.
I can see yourself.
Okay, are you okay? Everybody okay?
Yes, I'm waiting.
I'm waiting.
Okay.
Okay.
Clear. We can.
Clear, see? Okay.
Yes.
Okay.
And your presentation again, please.
She's like first slide. Okay. Good afternoon, everybody. My name is Dr. Aumimo, Director of Urban Environmental Conservation and Cleansing Environmental Management Authority, on behalf of Yangon City Development Committee, on behalf of Myanmar. I would like to present the solid waste management in Yangon City during COVID-19 pandemic. So our country, Myanmar, and Yangon City is a leading city and economic city population around about 7.2 million and 1 million habitat in Yangon administrative boundary. And then our country saw the COVID-19 last country all over the world. And we suffered the studying had been spread in Yangon city since March 2020. And then in that period, we are first wave suffered in Yangon and all around the Myanmar. And our city responsibility and service of waste management around about the 8 kind of waste. You can see left side household waste, healthcare waste, offenses, normal, industry, commercial and construction and garden waste. Now, COVID waste and new waste for our country and Yangon city. So now our people and our worker wear the PPE and everywhere, every day collected the COVID-19 waste from quarantine center and semi-lockdown area. Please wait. So you can see the flow sheet diagram. The waste source, healthcare waste, normal waste, and hospital and clinic care treated for COVID patient waste and quarantine center, and contact lockdown and semi-lockdown area and area fixed to our city. And we would like to use every waste box type container collection truck, and our labor or our worker wear the complete set of the PPE, and every day we collect from the dead box type truck and go to this was the side, and then that all of them are there's a COVID-19 waste. We would like to do the incineration process in healthcare waste incinerator and CC tons per day incinerator. And COVID-19 spread Yangon, and our department leading the 1 officer and 20 worker and 20 driver. So totally 41% plus 1. Every day they collect the waste from the relevant area and go to dispose and incinerate to designated area. Okay. And then we started from April, May, June, July, August is I think our country suffered the lower level, and we suffered the second wave from September, October this month, and which generated amount is 3 times from the August, July, June, May, and April. Now we increase the collection labor that in this time, so 90% the collected labor on ground. And then you can see our lockdown area and COVID-19 quarantine center. Nowadays, quarantine center around about the 289 center and similar around place everywhere of the administrative boundary of Yangon, 689 place. You can see this picture, first picture, before the collection, that officer would like to train to how to get the waste, how to put up the waste, how to handling the waste and safety for their side, and they best wear the PPE and go to the incineration plant and go to proper, please. Proper incinerate to designated area during COVID-19 waste at the Foundry Center, and Yangon City have 2 places of healthcare waste incineration plant and 60 tons per day incineration plant. And this is a special case for our protect the disease spread out at our general hospital. Every night, COVID-19 suffer patient go back to their home, and then remaining their room and their bed and their wally. So our people, our staff, every night spray the protective medicine and liquid for safety and spread out the protective from diseases. And thank you very much for your kind attention.
Thank you very much, Mr. Aomimo. Thank you for your presentation. Okay, Dubai. Please let me ask again, somebody from Dubai, do you have something to share with other participants, or could you speak something to other participants? Dubai? Okay. Okay. So we have had all the participant cities gave us a great information, so we could share a very helpful information from the cities. But we are running out of time, so we only have a few minutes for discussions. Is there anybody who have questions? On the chat box from Mexico City, yes, there's one question to Melbourne, but Ms. Clark from Melbourne has already quit this Zoom call. I'm sorry. So we are asking Ms. Clark this question later and tell it using email later. So anyone else have any questions to the other participants or Ms. Dilley? If you have a question, please turn on your camera and microphone. Okay. Any questions? Okay, let me ask one question to all the cities. Is there any city which has experienced confirmed case of waste-to-person infection, for example, from municipal solid waste to collection workers, or from medical waste to doctors? Is there any cities which has experienced such cases to date? Okay, so no city has experienced such a waste-to-person infection. So we have to take care more about the person-to-person infection. Okay. Is there any questions? Okay. So we are running out of time. I'm sorry we couldn't have enough time to discuss each other. That's all my. That is all our fault. Because when we set the timeline of this workshop, we couldn't have expected that so many cities would have joined. Okay, time is over, so I have to conclude this meeting. If you have more questions or answers, if you have more questions or any comments, we have prepared a Google document. We have prepared a Google document platform on Google Drive, and later we will send you the link. If you have questions, please use that platform. So please let me announce our next online workshop, which we are planning to hold in late November or in December. The topic will be green recovery from COVID-19 and circular economy. Okay. Everybody, thank you for your contribution. We are very grateful to all of you. Let's keep in touch via email or the platform until the day we will overcome the pandemic together. So let's conclude the meeting. See you next time.